So Amazon has decided that it's going to fix healthcare. Healthcare is obviously totally botched in the United States. And we are spending roughly 20% of our nation's output of goods and services on healthcare in the United States. Most developed countries spend about 8%. And so we're using basically 2.5 times our national income towards healthcare, and we have inferior returns from other countries. Americans live shorter lifespans. I know I've had a lot of feedback on Clark Stinks over the years when I point out that our lifespans are so inferior to other countries, including undeveloped countries, not the wealthy countries that you think of as our peers. Our lifespans are crazy poor, and that's in spite of this massive spend. We have so many inefficiencies, I can't even start. Well, Amazon, that created tremendous efficiencies, obviously, in the delivery of goods, thinks that they have a role to play in healthcare, and they bought One Medical. We had complaints from people about Amazon buying One Medical. They'd really enjoyed using it. And for those of you who are not familiar with One Medical, it's a network of primary care offices that you pay an annual subscription to be able to go to, but then you have the continuity of care and you actually get to see somebody. And it's under Amazon's ownership, it's $200 a year. Some people who are Prime members will get offers for the first year for various rates less than that, like $149, that kind of thing. But what do you actually get? So what you get is you get virtual care in text messaging, equivalent of text messaging, or video kind of things, on-demand video chats with a medical professional. And in the One Medical app from Amazon, you're able to request scripts without seeing somebody. They also have traditional offices you can go to and see a doctor. And so this is something that fills potentially a need in the marketplace because, as I talked about before, so many people no longer have a primary care doctor, and their medical care is so haphazard, and there's no continuity of care. The idea of being an all-electronic kind of record keeper at Amazon One Medical is that your records are all digitized and can be seen by anyone you're talking to on a chat or a video conference anywhere in America who is dealing with your medical issues you're having at that time. It's all set up, though, to be virtual, although you can go to a physical office. And there are things a doctor or medical professional can successfully diagnose and treat in a virtual session. But many times what you need is you need to actually be seen in person by a human. So, yeah, it is obviously a significant improvement over having no continuity of care at all. I think time will tell, or won't show, that Amazon One Medical is a good idea or not a good idea. We'll know with time, but it's just one of the conundrums going on with healthcare, because one of the things is people who end up with traditional health insurance many times find that doctors don't like that insurance, and you're looking around for someone that will see you, that will take care of you. And so there you are, not as somebody who's uninsured who has no primary care doctor. You're somebody who has insurance, and you're having to struggle to find someone who will see you. The real problem is the extreme shortage that I've addressed before of doctors willing to practice primary care. Why is it that they don't want to practice primary care overwhelmingly? because they took so many years and spent so much money to go through medical school. And on the totem pole of pay, being a pediatrician or primary care doctor is absolutely the lowest pay there is. And that's why you're going to see in the United States that primary care overwhelmingly is going to be provided by nurse practitioners and physician assistants, because nobody who has an MD by his or her name wants to do it anymore. But this is a problem. One other thing I want to reinforce that came up recently in a question: know that when you're being referred out for tests or imaging, many times being a cash payer will get you a lower price than what you have from your own health plan. And know about self-dealing, where behind the curtain, most doctor practices now are in a network where they're either owned by or they're a prisoner of a particular hospital system. So all their referrals are within that major hospital system that charges as much as 20 times street price for something that you are being referred to have done. So know this, be aware of it, and know that because of the money you're having to pay out of your pocket, you've got to shop around. With insurance, we get so many complaints, particularly with our Team Clark Consumer Action Center, hearing from people who the insurance company denies payment for something or denies authorization for something. Know that this is a cat and mouse game, where in fact there's a whistleblower thing that one of the major insurers, in this case Cigna, is rejecting claims without ever reviewing them and waiting to see, allegedly, if people come back to challenge the denial. The reality, most people just take that denial and they say, oh, well, I don't have coverage. And the reality is you have to be willing to be your own advocate and fight back, because so often it's a cynical attempt by an insurer to avoid paying your bills. Gosh, did I kind of draw a big circle about how messed up healthcare is in the United States? I did.